Hello, it's Midday. Good afternoon. Welcome to JNews Today with me, Carlos Caloni. Our top stories this hour. Government launches performance tracker to enhance transparency and accountability in infrastructure project implementation nationwide. Meanwhile, the National Democratic Congress says the governing New Patriotic Party has nothing to show after more than 7 years in office. Also, Parliament Educate Committee wants some dilapidated schools structures renovated. These plus business, sports, and showbiz make up the package. Stay with us. Thank you so much for choosing us. Now, the Ministry of Works and Housing says the newly outlawed performance tracker is an enhanced version of a previous platform commissioned by the Vice President, Dr. Mahmoud Bawumia, in 2020. Government says it has listed 13,000 projects tagged with their geolocation on this live website. Works and Housing Minister Kojo Nkrumah, at a ceremony to rechristen the platform, indicated that the intention is to promote transparency and accountability in the execution of infrastructure and other projects across the country, categorized into 22 thematic areas.
A lot of work has gone on, as Professor Piedu mentioned, and that work is what has led us to what we call today the performance tracker, or what some will call the Tracker 2.0. The URL will read performancetracker.gov.gh. So what is the performance tracker? The performance tracker is, first of all, a database. It's a database that showcases the performance of the government of Ghana. And it showcases it through the various projects that have been executed across the 261 districts. And this database has two interfaces. One is a website. So you can go onto that website, www.performancetracker.gov.gh, and you can access that database, and shortly I'll take you through that database. The other is an app. Today, the mobile phone is a very powerful tool, sometimes even beyond what your desktop can do. And on the app, on the iOS system, as at now, I'm told the app version has been uploaded, and in the coming weeks, on the Android system, the app version will also be uploaded. So it's a database. You can access it through a URL, performancetracker.gov.gh, or you can download the app and access that database. And what it does is that it showcases the performance of the government of Ghana across the 261 districts, across the 28 ministries, and across the 16 regions. Now, it's an enhanced version of the 2020 tracker that the government put out. And the enhancement is in three features. First, it's more user-friendly than before. It's easier to navigate this particular database. Second, it's gone through a very rigorous validation exercise. And as was mentioned, down through to the district level, town by town, to geotag the projects and to take photos of the project so that you can see it. It's also got, for the first time, metrics. Data that you can then analyze and do the necessary comparisons, and we'll take you through it shortly. It is a live platform, and so even as we go on from today, there will be a continuous exercise to update and to validate. The latest data set you will find on it is June 2023. That's the latest.
Members of Parliament on the ticket of the opposition National Democratic Congress said government performance tracker will show that the governing New Patriotic Party has nothing to show after more than 7 years in office. NDC MP for Buem, Kofi Adams, says the previous tracker appropriated NDC project and some of the so-called achievements simply did not exist.
When they launched their first tracker, Joy was one of the stations that followed through and exposed the many lies and falsities in the so-called tracker. In my own constituency, They launched bridges they claim they have constructed, roads they claim they have done, when actually nothing has happened there. In my constituency in Buim, there's supposed to be a bridge between Accra community and Accra Cortes that they have done nothing, but their trackers then said they have done it. They claim they have done the road between Guama community and Atonko, which had not been done. They place all these things in a tracker. At least I've given you that of my constituency. Same thing happened in many other areas. So I will not be surprised that they will be launching another pack of lies. But we will check it. And I know you will lead the charge on that. We won't stop them from launching their so-called tracker, but let them launch it and we will check. And just as we did in the first one and we exposed the false cities, you'll be seeing it this time around again, except that they will follow it with all that. After all, they are ministers. The Ashanti regional minister was on a program. He was asked to mention at least 5 projects that they have initiated in Ashanti region where he has been the regional minister since they came to power. He couldn't. The current minister for roads and highways was also on a program. And they asked him to mention projects. You know the projects you could mention, projects that way. I would not have been worried if these liabilities as presented is matched with developments that we see around the country. That we have good roads, that we have proper electricity supply, that we have proper markets, that we have good hospitals to attend to, that we have good schools, and so on and so forth. That you are seeing investments and you see the liabilities, there wouldn't have been any problem. Like the previous administration did. We invest heavily in, say, the Ghana gas, and so it's repaying for itself. You invested in airports, it's paying for itself. You invested in hospitals, and we see this around, roads and what have you. But this huge jump, this huge liability cannot be matched with developments that we will see. So it has remained phantom expenses that cannot be matched with anything on the ground. But because if you pay Power China, MS Power China for the Palugu project of almost $12 million and they have done nothing, how will that even help the economy to grow? Because the whole idea is to help irrigation so that persons who live from those regions coming down seeking for jobs would not. And that during dry season, they could still continue with farming. Now you have paid almost 12 million of our money to them. You've done nothing. That becomes liability for us.
Now, the Ministry of Finance and Works and Housing are jointly working to expand the National Home Ownership Fund to provide affordable housing for public servants across the country under a district housing program. Works and Housing Minister Kojo Nkrumah, who made the announcement at the validation workshop for a new Ghana Housing Profile 2024, said the project has been piloted and is waiting for the release of funds from the Ministry of Finance for a full rollout. There's more in the following report. We'll bring that report later on. But moving on, a member of the Parliamentary Select Committee on Education and MP for Kintampo North, Joseph Kumar, is asking government to immediately fix the full DA and Julo DA schools. He says these structures are in terrible shape and need urgent attention. The MP made this call during a joint field visit by members of the Select Committee on Education. The Ministry of Gender and Education toured some schools in the northeast Gonja district of the Savannah region.
Understanding of the challenges being faced by schools in the area. The trip was organized by the School for Life, an NGO in the northern region. In an interview with the media, the MP for Kintampo North, Joseph Kumar, said the issue needed to be addressed urgently.
I will visit since morning to interact and to personally observe the nature of the school infrastructure we have here. They are all dilapidated structures, nothing to round home about. They need immediate fixing and many other things. School feeding is not regular in the schools, but the scorecard system that the NGO use, they interacted with the citizens, that's the community people, and at the same time, the Ministry of Education and that of the GES
The Member of Parliament for Lambuse, Dr. Bright Yelvier Bake, said there was the need to find a lasting solution to the problems.
And I think that these are more of policy issues. These are more of decisions and direction of government. And as a member of the ruling party and a member of the committee, I think that when we get back, we will report to. Fortunately, we came along with a clerk, assistant clerk to the committee, and he's going to do a report that the entire committee will discuss and further engage with the ministry and the minister, Ghana Education Service, so that we find a lasting solution to these teething problems in these communities.
Director for Pre-Tertiary Education, Anna Bafwe, said the issues were presented to the minister.
Yeah, for the two places that so far we've gone to, it looks as if the issues is running through all the places. One is about the inadequate teaching learning resources, inadequate classrooms, then we don't have inadequate furniture, and a whole lot of them. So as a ministry, what we intend doing is that when I get back to the minister, I'm the director for pre-tertiary education. Every message will be conveyed to the minister, and I have also promised them that I will follow it up for them.
A representative for the School for Life said they were excited about the attention being drawn to the challenges.
As within the space of CSOs, this is already an outcome that we have been able to trigger a discussion that brings almost every important aspect of this country into this community. We have been able to bring together everybody, including the president, because we have the representative of the president here, and we cannot be ungrateful. So we show much gratitude for your time and
where the Ministries of Finance and Works and Housing are jointly working to expand the National Home Ownership Fund to provide affordable housing for public servants across the country under a district housing program. Works and Housing Minister Kojo Nkrumah, who made the announcement at a validation workshop for a new Ghana Housing Profile 2024, said the project has been piloted and is waiting for the release of funds from the Ministry of Finance for a full rollout. There's more in the following report.
Access to decent housing is a fundamental human right. Across sub-Saharan Africa, however, the right remains an elusive dream for many households in Ghana. According to the latest data from the Ghana Statistical Service, there is a staggering home deficit of about 1.8 million in Ghana. The Minister of Works and Housing, Kojo Nkrumah, indicated government is committed to fill the gap by
Now moving on, Finance Minister Dr. Mohamed Amin Adam has donated 10 polytanks to address the water challenges the Tamale Teaching Hospital is currently facing. He's also made available 10,000 Ghana cedis to renovate the underground reservoirs of the hospital to end the crisis. The Finance Minister also donated 3 dialysis machines to augment healthcare delivery at the facility.
Water crisis in recent times, forcing the Chief Executive Officer of the hospital to cry out for help. It is against this background that the Minister of Finance said he had come in to help. Speaking at a ceremony at the Tamale Teaching Hospital, Dr. Mohamed Amin Adam said when people are sacrificing like the health workers were doing, there was the need for all to support with the logistics to enable them deliver. He said an appeal made to his office indicated water was their #1 priority.
So he said water problem was his #1 in the hospital. He needed support. So I promised to provide polytanks And today I brought the 10 poly tanks to the hospital to help address the problem. I'm also told that you have underground tanks which need to be refurbished, and Ghana Water Company has asked you to pay some money for them to refurbish it. I did not say this in the meeting, but I made up my mind that I was going to find the money to the hospital to give to Ghana Water Company to come and refurbish the tank so that we can address the water problem, holistically.
Dr. Amin Adams said the 2 dialysis machines serving the population of the northern region and beyond was woefully inadequate reason for his support.
Then I also expressed worry about what I've heard about the dialysis unit, where people have to queue, long queues to be able to seek dialysis services. And I know that some of them have died because they have not had access to these services. And 2 dialysis machines here against the population that require the services of dialysis, I think is woefully inadequate. I mean, I didn't even know that you had 2 machines. We should have responded much quicker than we have done. All the news in Accra is about Kolebu dialysis unit, but nobody has talked about the fact that Tamale Teaching Hospital has 2 dialysis machines serving huge population, including people coming from Upper East, Upper West, Northeast, Savannah, Burkina Faso, and beyond that, and so I'm here to donate also 3 dialysis machines.
Responding to the guest, the CEO of the Tamale Teaching Hospital, Dr. Adam Atiku, thanked the minister for coming in handy.
Without water, you need water to do almost all the things that we are there for our operations, the theaters. You need water. You need water to prevent infection. And then even the dialysis machines that we are going to receive. So the dialysis machine that we have received, the polytank are going to support the operations of the hospital. And we want to give you assurance that we are going to make good use of those polytanks. And then as well, the dialysis machines, as we see now, there are certain patients that we don't dialyze. Patients with hepatitis B, hepatitis C, HIV. These patients are usually referred because we don't have enough or adequate machines. And now with these new machines, we can make provisions for these type of patients as well.
Now, the episode 2 of Breaking the Chains of Neglected Tropical Diseases, NTDs, in Central East District in the Ashanti region, we highlight challenges faced by 13-year-old Rahel Agama and 50-year-old Kojo Asare. Rahel endures a ridicule from her schoolmates due to her affliction and lymphatic filariasis, while Kojo's Buruli ulcer condition has placed significant financial strain on his family, rendering him unable to provide for his 4 children. Mahmoud Mohamed Nuruddin has more in the following report.
50-year-old Kojo Asare from Bima number 2 developed a nodule at his former residence in Prestia, which eventually burst, resulting in a medical condition known as Buruli ulcer. Despite seeking medical attention and receiving medications, his condition deteriorated rapidly. As a result, Kojo relocated to Bima number 2 to stay with his brother as he was unable to work.
The pain is particularly intense, especially after taking a bath. It becomes so unbearable that I find it challenging to sleep. The pain persists throughout the night, often lasting until dawn before I can finally find relief and fall asleep.
Currently unemployed with 4 children, Kojo has been enduring the Buruli ulcer for 4 months. Financial constraints prevent him from seeking further treatment, leading to severe pain and sleepless nights. His inability to work has created financial strain for his family, worsening their financial difficulties.
We are currently unable to muster the strength and resources needed to care for my brother Kujasari and his children. Our situation feels hopeless, and we find ourselves without the necessary resources. In our time of need, we earnestly plead with generous and compassionate individuals to extend their help to us.
When he arrived, no one could recognize him until I eventually realized it was my brother. His leg was in a state of decay, and we had to use a blade to cut through his trousers before we could remove them.
A silent epidemic grieves this district. Scabies, lymphatic filariasis, yawns, leprosy, and even deaths from rabies have cast a dark shadow. 13-year-old Rahel Agana woke up one day to find that her left leg had increased in size, displaying signs of a condition known as lymphatic filariasis as diagnosed by medical doctors. Her father, Isaac Atinga, mentions that the condition had a significant impact on Rahel's school attendance as her classmates began to ridicule her because of the condition.
Due to her swollen legs, she initially refused to attend school, fearing mockery from her peers. However, she has now overcome these concerns and resumed her education. Despite the challenges, she maintains the vision of becoming a nurse in the future.
Rabies is a fatal viral disease transmitted through infected dog bites, while Buruli ulcer causes severe skin, bone, and tissue damage. Yawns and leprosy are chronic bacterial infections affecting the skin, bones, and nerves. Lymphatic filariasis causes abnormal enlargement of limbs and genitals due to mosquito-borne worms in the lymphatic system. These NTDs cause disfigurement, disability, among others, leading to stigma and discrimination. They primarily affect rural, conflict-ridden, and underserved areas with limited access to clean water and health care. Ghana faces 14 NTDs, with every district reporting at least 2 of the diseases. In 2023, Setre East District reported 2,553 cases, including scabies, lymphatic filariasis, yawns, leprosy, and 7 tragic deaths from rabies among children.
Dr.
Justice Ofori Amwa is the Setre East District Director of Ghana Health Services.
Setre East has so far recorded about 2,471 cases of scabies for the year 2023. We have recorded 7 deaths associated with rabies. We have also recorded 55 cases of yaws. We have also put 5 cases of leprosy on treatment, and the cases are reporting. Again, we have about 22 cases of lymphatic filariasis.
Childness, ignorance, and spiritual beliefs have kept these suffering souls from seeking help.
Now, some graduate unemployed nurses and midwives are demanding financial clearance from the government to facilitate their employment into the health sector. The graduates from various public universities, nursing training colleges took to the street of Kumasi to vent their displeasure over the delayed posting. There's more in the following report.
Involved the 2020, 2021 and 2022 batches of the unemployed graduate nurses and midwives. The low turnout of members would not deter the few from marching from the Kumasi Cultural Center through some principal streets of the city to register their discontent. Haruna Ibrahim is the president of the Graduate Unemployed Nurses and Midwives Association.
When we had the first demonstration in Tamale, we were told that the Ministry of Health and then the Ministry of Finance are meeting to discuss I don't know who instructed that, but then that was the message we got, that they have been assigned to, instructed to meet to discuss our clearance. The next day, we saw a release from the Ministry of Health addressing what we described as ghost officials at the Ministry of Health. At the Ministry of Health and Ministry of Finance, we think there are people there who are giving financial clearance and postings to some of our colleagues who can afford between 5,000 to 10,000. And when that money they pay to them. And immediately they get posted.
You have evidence to this allegation?
We know if there is no evidence, we have colleagues who are working on the field. When you ask them, they say we did special posting.
4 years after graduating from nursing and midwifery training colleges across the country, the health professionals are yet to be posted to translate their theoretical knowledge into practice. With many health workers exiting the shores of the country to seek greener pastures, there is an obvious gap and shortage of human resource in the health sector. Records from the Ghana Registered Nurses and Midwives Association indicates that over 6,000 of their members have left between August 2023 and March 2024. The unemployed nurses and midwives, some of whom have had to take alternative job opportunities, share their frustrations.
I used to work with a private hospital, and then with the pay and the expenses at the end of the month, it wasn't enough. It isn't enough for us. So we are really frustrated in the house. Mentally, we are not mentally sound because it's not easy to complete school for 4 years and being in the house. Our parents are looking forward to us to take care of our young siblings. Now that we are in the house, how are you going to care for them?
Some died as a result of these driving, and some people also buy sell onion and other things. So it has been a whole lot of frustration.
The aggrieved health graduates presented a petition to the Ashanti Regional Coordinating Council for onward submission to relevant state institutions. The group plans to picket the finance and health ministries if their demands are not met.
After today, we hope and pray that after this our clearance is issued. Other than that, our next thing is we are going to sleep at the Ministry of Health and Ministry of Finance. So when we are going with our mats and our clothes. We are going to sleep there until our postings is given to us.
For Joy News, my name is Emmanuel Bryant Kweku.
This is still Joy News Today with me, Carlos Caloni. We'll take a short break. We'll return with more. Please stay.
Hi, good afternoon. Welcome to the business segment on Joy News Today with me, Pius Kojobaka. Inflation for the month of March 2024 has seen a sharp increase to 25.8% from 23.2% recorded in February 2024. Inflation for both locally produced items and imported items went up substantially to 26.6% and 23.8% respectively. According to the Ghana Statistical Service, food, non-alcoholic beverages and transport were the main price drivers for the rate of inflation. It added that food inflation went up by 29.6%, while non-food inflation recorded 22.6%. And we shall be bringing you more on Marketplace. Stakeholders within the pharmaceutical industry are concerned about the increase in import of medical devices, disposables, and equipment used in Ghana. They are calling on government to further reduce import duties and support the quest to manufacture some of the equipment locally. According to Chief Executive Office of the Federation of Africa Medical Equipment, Disposable and Devices, as well as manufacturers and suppliers, Anthony Ameka, the taxes are affecting the operations. Here's a report.
Holders say medical devices constitute the largest product area, accounting for over 60% of all importations within the health sector. Mr. Ameka indicated that globally the medical device industry is poised for steady growth, with global annual sales forecast to rise by over 5% a year and reach nearly $800 billion by 2030.
About 98% of medical devices and equipment currently that is being used in the country are all imported, and that raised a concern. So there was an engagement with the government, and as a result, in the last budget that was presented to Parliament, the government is waiving the import taxes and also VAT on imported medical devices and equipment, so as to make it more accessible and affordable in the country. We are still running the 98% import into the country. We don't have much improvement in terms of local production.
The third edition of the Pharmaceutical, Medical and Healthcare Exhibition in Ghana, West African Pharma Healthcare Expo, will be organized from the 8th to the 10th of May 2024 in Accra.
And to some other business stories, MTN Ghana has donated 20,000 cedis and some assorted items to the National Chief Imam, Dr. Sheikh Osman Nuhu Sharuptu, ahead of the celebration of this year's Eid al-Fitr. Now, according to the Senior Manager for Customer Relations and Credit Management at MTN, Salihu Abu, the gesture is aimed at deepening relations with the Muslim community.
MTN Ghana, as part of this year's Eid al-Fitr celebration, has donated a cash prize of 20,000 Ghana cedis and some food items to the National Chief Imam. The items included bags of rice, cartons of vegetable oil, packs of mineral water, and other items. According to Senior Manager for Customer Relations and Credit Management at MTN, Salihu Abu, the gesture is to support the Muslim community as they celebrate this year's festivities.
This morning, as custom demands, we are here to present our donation to the Office of the National Chief Imam to support in giving good, food to members of the community so that they can also celebrate Eid al-Fitr well. Now, this year's donation, as you all may be aware, is quite different because earlier, some couple of weeks ago, His Eminence, the National Chief Imam, lost his beloved wife. So we shared our management's condolences to the Office of the National Chief Imam and made our commitments that during the 40th day at Dua, which is the prayer session, MTN would also come and commiserate with the Office of His Eminence.
MTN also pledged to set up stands at vantage points to provide customers with enhanced customer service during the celebration.
That's it for business for now. I am Pius Kojo Baka.
Now, showbiz news today. Award-winning American rapper Ja Rule is in Ghana for the groundbreaking ceremony for the construction of a classroom block at Noaso Anglican Primary School here in Ghana. Ja Rule's latest education venture is in partnership with Pencil of Promise, a U.S. non-profit organization that builds schools and increases educational opportunities in Africa. This also follows Ja Rule's announcement of expanding his philanthropic activities to Ghana in January 2024 in a post on X, formerly Twitter, this year. Now, my colleague Jacqueline Ansoma Yeboah is live with the team at Lower Manya Krobo. Hello, Jacqueline. So what is the latest on this story where you are now from Manya Krobo?
Groundbreaking project of a 6-unit classroom block is also happening and he hopes to come back next year once the school is fully completed, and also to make sure that every child in Ghana has access to quality education. But one thing we need to know that this is not his first time in Ghana. He's been here in 2008, and this is the second time right here, and he's back to build this school in collaboration with Pencils and Promise right here inside Lower Menya Krobo. So we're about to kickstart with the groundbreaking project. We're done with the first part of the project. The team and everybody is moving to the section. So as you can see right behind in front, everybody is moving to the place where the project itself is happening.
Why Krobo specific? Is there anything? Jacqueline, I'm asking if we know why the decision to site this project in that part of the country.
Okay, so basically he said earlier that he envisions that all kids in Africa, to be particular in Ghana, have access to quality education. But he had a conversation with the CEO of Pencils and Promise, and she said that she had spotted a particular school right here, and the school sometime back in 2020 had their roof gone off as a result of a heavy downpour here, and they have a whole lot of issues when it comes to the school. So he decided to come back here. In January 2024, he posted on his X platform that he wanted to pick up a philanthropic project in Ghana. He didn't state where, but then he was in talks with Pencils and Promise, and he decided to settle here. So as of now, we can't really say that initially he had this particular area in mind.
All right, Jacqueline, we understand also that he made some stopovers on his way to this place. Can you share some light on that for us?
Carlos, kindly come again.
I'm asking, we understand that on his way to where you are now, he made some stopovers along the route. Tell us more about that.
Yeah, so on his way, he made, it was right here inside Lower Menya Krobo, that is Krobo Odumase. He met with the municipal chief executive just to say hi to them. And obviously, Jaru has a lot of fans right here in Ghana. So he made a stop, had an interaction with his fans inside Eastern region. So basically, that was what the stop was for.
Thank you so much, Jacqueline and Soma Yeboah, as with Jaru's team there in Manya Krobo. We'll keep our eyes on that story and update you subsequently. Up next is World News. Please stay. Now, in our world news this afternoon, 6 men have been arrested in connection with the killing of South African footballer Luke Flair. The 24-year-old Kaiser Chiefs star was shot dead in a carjacking at a petrol station in Johannesburg last week. In a statement, police said that the 6 suspects were arrested in Soweto on Wednesday morning. The police say they believe, quote, the suspects are part of a syndicate that is responsible for carjacking, end of quote, in the province. Now, investigators are still actively searching for more suspects relating to this case. And that's all we have in this hour. You can log on to myjoyonline.com for more stories. My name is Carlos Keloni. Thank you so much for watching. Have a great afternoon.